Hey there, and welcome to our video on supplements for stress relief. In today's fast-paced world, stress is a pervasive issue that affects many people, and while some stress is normal, chronic stress can take a serious toll on both physical and mental health. In this video, we'll be exploring natural supplements that may help support the body's stress response and promote relaxation. We'll dive into the science behind adaptogens like ashwagandha and rhodiola, amino acids like L-theanine, vitamins like B-complex and vitamin D, and minerals like magnesium. By the end of this video, you'll have a better understanding of how these supplements work and how they may fit into a holistic approach to stress management. So, let's get started. While no supplement can replace a healthy lifestyle, certain nutrients and herbs have shown promise in reducing stress and anxiety symptoms in some studies. However, it's important to note that supplements are not a magic solution for stress relief. They should be used cautiously under the guidance of a healthcare professional, as they can interact with medications and cause side effects. Additionally, more research is needed to confirm the long-term efficacy and safety of many stress supplements. Always consult with a qualified practitioner before adding any new supplement to your routine. Let's start by talking about ashwagandha, an adaptogenic herb commonly used in Ayurvedic medicine to help the body cope with stress. A randomized, double-blind, placebo-controlled study by Gopkumar and colleagues, published in 2021, found that supplementation with 250 to 600 milligrams of ashwagandha extract daily for 8 weeks significantly improved stress and sleep quality in 60 healthy adults compared to placebo. Participants reported feeling less stressed and had lower cortisol levels, which is a marker of stress response. Another small study by Lopresti and Smith, published in 2021, investigated the effects of 240 milligrams per day of ashwagandha extract for 2 months in 30 adults with self-reported anxiety. While the ashwagandha group experienced reductions in anxiety, depression, and stress symptoms, the changes were not statistically significant compared to placebo. The researchers noted that larger sample sizes and longer study durations may be needed to detect significant effects. Ashwagandha is generally well tolerated with few reported side effects in clinical trials. However, some people may experience mild gastrointestinal discomfort, drowsiness or headaches, according to the study by Gopkumar and colleagues. It's important to follow dosage instructions and not exceed recommended amounts. More research is needed to establish the long-term safety and efficacy of ashwagandha supplementation for stress relief. Pregnant women, those with autoimmune disorders, and people taking certain medications should avoid ashwagandha unless under medical supervision, as noted by Lopresti and Smith. Next up, let's discuss rhodiola rosa, another adaptogenic herb that has been traditionally used to enhance the body's resistance to stress. A 2022 literature review by Ivanova, Stocheva, and Quintella concluded that rhodiola supplementation may help regulate the body's response to physical and mental stress. The review analyzed preclinical and clinical studies, finding that rhodiola's active compounds, such as salidroside and rosavin, may modulate stress-related pathways and neurotransmitters. In a small study by Cropley and colleagues, published in 2015, 400 milligrams per day of rhodiola extract for 14 days significantly reduced self-reported stress, anxiety, anger, confusion, and depression in 8 people with mild anxiety compared to placebo. The researchers suggested that rhodiola may help improve stress resilience and emotional well-being. While these preliminary findings are promising, more research with larger sample sizes and longer durations is needed to validate the stress-relieving effects of rhodiola. Additionally, standardization of rhodiola extracts and optimal dosing regimens need to be established, as noted in the review by Ivanova, Stocheva, and Quintella. As with any supplement, it's important to consult a healthcare professional before taking rhodiola, as it may interact with certain medications and cause side effects like dizziness or dry mouth in some people, according to the study by Cropley and colleagues. Moving on, let's talk about L-theanine, a unique amino acid found primarily in tea leaves. It has gained attention for its potential calming and stress-reducing properties. A randomized, placebo-controlled trial by Heidse and colleagues, published in 2019, investigated the effects of L-theanine on stress-related symptoms in 30 healthy adults. Participants took 200 milligrams per day of L-theanine or placebo for 4 weeks. The L-theanine group had significantly greater reductions in stress-related symptoms, including depression, anxiety, and sleep disturbances, compared to placebo. A 2020 systematic review by Williams and colleagues analyzed 9 randomized controlled trials on the effects of L-theanine, either alone or in combination with other compounds, on stress and anxiety in humans. The review concluded that 200 to 400 milligrams per day of L-theanine may help reduce stress and anxiety in people exposed to stressful conditions. L-theanine is generally well tolerated, with few reported adverse effects. However, some people may experience minor side effects like headaches or drowsiness, according to the study by Heides and colleagues. It's important to follow recommended dosages and consult a healthcare professional before use, especially if pregnant, nursing, or taking medications. More research is needed to determine the optimal dosage and long-term effects of L-theanine supplementation for stress management. Additionally, most studies have been conducted in healthy populations, so the efficacy of L-theanine in individuals with clinical anxiety disorders requires further investigation, as noted in the review by Williams and colleagues. Next, let's discuss magnesium, an essential mineral involved in numerous physiological processes, including nerve and muscle function, energy production, and mood regulation. Magnesium deficiency has been linked to increased stress and anxiety. A 2017 systematic review by Boyle and colleagues analyzed 18 studies on the effects of magnesium supplementation on subjective anxiety and stress in humans. The review concluded that magnesium supplementation may have a beneficial effect on mild anxiety, but the quality of evidence was poor due to methodological limitations and small sample sizes. The authors noted that magnesium's potential anxiolytic effects may be related to its role in regulating neurotransmitters involved in the stress response, such as gamma-aminobutyric acid, or GABA. However, more high-quality randomized controlled trials are needed to establish the efficacy of magnesium supplementation for stress and anxiety relief. Magnesium supplementation is generally safe and well tolerated when used in appropriate doses. However, excessive magnesium intake can cause adverse effects like diarrhea, nausea, and abdominal cramping, according to the review by Boyle and colleagues. It's important to follow recommended dosages and consult a healthcare professional, especially if you have kidney disease or are taking medications that interact with magnesium. The optimal dosage of magnesium for stress and anxiety relief is not well established. Most studies have used doses ranging from 200 to 600 milligrams per day of elemental magnesium, as noted in the review by Boyle and colleagues. More research is needed to determine the most effective dose and form of magnesium supplementation for stress management. Moving on to B vitamins, which include thiamine, riboflavin B2, niacin, pantothenic acid B5, pyridoxine B6, biotin B7, folate B9, and cobalamin B12. These vitamins play crucial roles in brain function and mood regulation. Some studies suggest that B vitamin supplementation may help reduce stress and improve mood. A 2019 systematic review and meta-analysis by Young and colleagues investigated the effects of B vitamin supplementation on mood and stress in healthy and at-risk individuals. The review included 12 randomized controlled trials with a total of 1,070 participants. The meta-analysis found that B vitamin supplementation for at least 4 weeks had significant positive effects on stress and mood compared to placebo. The authors suggested that B vitamins may help reduce stress by lowering homocysteine levels, which have been associated with increased stress and anxiety. B vitamins are water-soluble and generally safe when taken in recommended doses. However, excessive intake of certain B vitamins, such as niacin and pyridoxine, can cause adverse effects like skin flushing, nausea, and nerve damage, as noted in the review by Young and colleagues. It's important to follow recommended dosages and consult a healthcare professional, especially if you have pre-existing health conditions or are taking medications. The optimal B vitamin combination and dosage for stress relief is not well established. Most studies have used B vitamin complexes containing various doses of individual B vitamins, according to the review by Young and colleagues. More research is needed to determine the most effective B vitamin formulation and dosage for stress management. Next, let's talk about vitamin D, a fat-soluble vitamin that plays important roles in bone health, immune function, and mood regulation. Low vitamin D levels have been associated with increased stress, anxiety, and depression. A randomized, double-blind, placebo-controlled trial by Fokker and colleagues, published in 2021, investigated the effects of vitamin D supplementation on depressive symptoms and stress reactivity in 110 children and adolescents with vitamin D deficiency. Participants received either 1,600 international units per day of vitamin D3 or placebo for 4 months. The study found that vitamin D supplementation significantly reduced depressive symptoms and improved stress reactivity compared to placebo. Participants in the vitamin D group had a less prolonged cortisol response to a psychosocial stress test, suggesting improved stress resilience. Vitamin D supplementation is generally safe when used in recommended doses. However, excessive vitamin D intake can cause adverse effects like hypercalcemia, kidney stones, and gastrointestinal symptoms, as noted in the study by Fokker and colleagues. It's important to follow recommended dosages and consult a healthcare professional, especially if you have certain health conditions or are taking medications that interact with vitamin D. The optimal vitamin D dose for stress and mood benefits may vary depending on individual factors like baseline vitamin D status and sun exposure. Most studies have used doses ranging from 1,000 to 4,000 international units per day of vitamin D3, according to the study by Fokker and colleagues. More research is needed to establish the efficacy of vitamin D supplementation for stress relief in non-deficient populations and to determine the most effective dosage. Moving on to lemon balm, also known as Melissa officinalis, a perennial herb in the mint family that has been traditionally used for its calming and stress-relieving properties. Some preliminary research suggests that lemon balm supplementation may help reduce anxiety and improve sleep quality. A randomized, double-blind, placebo-controlled trial by Haybar and colleagues, published in 2019, investigated the effects of lemon balm supplementation on anxiety and sleep quality in 80 people undergoing coronary artery bypass surgery. Participants received either 500 milligrams of lemon balm extract or placebo 3 times daily for 8 weeks. The study found that lemon balm supplementation significantly reduced anxiety and improved sleep quality compared to placebo. The lemon balm group had a 49% reduction in anxiety scores and a 54% improvement in sleep quality scores compared to baseline. Lemon balm is generally well tolerated, with few reported adverse effects. However, some people may experience mild side effects like headache, nausea, or dizziness, according to the study by Haybar and colleagues. It's important to follow recommended dosages and consult a healthcare professional before use, especially if pregnant, nursing, or taking medications. More research is needed to confirm the anxiety-reducing and sleep-promoting effects of lemon balm in healthy populations and to determine the optimal dosage. Most studies have used doses ranging from 300 to 1,100 milligrams per day of lemon balm extract, as noted in the study by Haybar and colleagues. Standardization of lemon balm extracts and long-term safety data are also lacking. While some supplements may offer potential stress-relieving benefits, others lack efficacy evidence or carry risks of serious adverse effects. One such supplement is kava, also known as Piper methysticum, a plant native to the South Pacific Islands. Kava has been traditionally used for its calming and anxiety-reducing properties. However, a double-blind, randomized, placebo-controlled trial by Savage and colleagues, published in 2019, found no significant differences in anxiety symptoms between kava and placebo after 16 weeks of supplementation in 171 adults with generalized anxiety disorder. Moreover, kava has been associated with rare but serious side effects like liver toxicity, leading to several countries banning or restricting its sale, as noted in the study by Savage and colleagues. The World Health Organization and the United States Food and Drug Administration have issued warnings about the potential hepatotoxic effects of kava, especially with long-term use or in combination with other substances that affect the liver, according to the study by Savage and colleagues. Given the lack of efficacy evidence and the potential for serious adverse effects, it's best to avoid kava supplementation for stress relief unless under close medical supervision. Always consult a healthcare professional before taking any supplement, as they can interact with medications and have side effects. When considering supplements for stress relief, it's important to keep in mind that supplements are not a replacement for a healthy lifestyle and should be used as part of a holistic stress management approach. Here are some key considerations. First, before starting any supplement regimen, consult a qualified healthcare professional, such as a doctor or registered dietitian. They can help you determine if a supplement is appropriate for your individual needs, assess potential risks and interactions, and recommend safe and effective dosages. Second, choose high-quality supplements that have been independently tested for purity and potency by reputable third-party organizations such as USP, NSF, or Consumer Lab. Be wary of supplements with exaggerated claims or those that promise quick fixes for stress relief. Third, always follow the recommended dosages on the supplement label or as advised by your healthcare provider. More is not necessarily better when it comes to supplements, and excessive intake can lead to adverse effects. Fourth, be aware of potential interactions. Supplements can interact with medications, other supplements, and even foods. For example, ashwagandha may interact with thyroid medications, while magnesium can interfere with the absorption of antibiotics, as noted in the studies by Lopresti and Smith and Boyle and colleagues. Always inform your healthcare provider about all the supplements and medications you are taking to avoid potential interactions. Fifth, prioritize a healthy lifestyle. While supplements may offer some stress-relieving benefits, they are not a substitute for a healthy lifestyle. Engaging in regular physical activity, practicing stress management techniques like meditation or deep breathing, getting adequate sleep, and eating a balanced diet rich in whole foods are the foundations of effective stress management, as noted in the study by Heidse and colleagues. Finally, be patient and realistic. Supplements for stress relief may not produce immediate or dramatic results. It may take several weeks or months of consistent use to notice any benefits. Additionally, individual responses to supplements can vary widely. What works for one person may not work for another. Be patient and realistic in your expectations, and don't rely solely on supplements for stress management. In conclusion, while certain supplements like ashwagandha, rhodiola, L-theanine, magnesium, B vitamins, vitamin D, and lemon balm show promise for stress relief, more large-scale, long-term human studies are needed to confirm their efficacy and safety. The existing research suggests that these supplements may help reduce stress and anxiety symptoms, but the evidence is limited by small sample sizes, short durations, and lack of standardization in some cases. It's important to remember that supplements are not a magic solution for stress management. They should be used cautiously under the guidance of a qualified healthcare professional, as they can interact with medications and cause side effects. Additionally, individual responses to supplements can vary widely, and what works for one person may not work for another. The foundation of effective stress management is a healthy lifestyle that includes regular exercise, balanced nutrition, adequate sleep, and stress-reducing practices like meditation or deep breathing. While supplements may provide some additional support, they should be used as part of a holistic approach to stress relief. Consulting with a healthcare provider can help you determine if a particular supplement is appropriate for your individual needs and how to use it safely and effectively. That's all for today's video on supplements for stress relief. We hope you found this information helpful and informative. If you'd like to learn more about stress management and find high-quality supplements, be sure to visit nutritionmarket.com. At Nutrition Market, we offer a wide range of supplements to support your health and well-being, and we have a virtual clinic with clinical nutritionists and naturopaths serving clients in Australia and around the world. Book a consultation today to get personalized advice and recommendations. Remember, while supplements can be a useful tool in managing stress, they should always be used in conjunction with a healthy lifestyle and under the guidance of a healthcare professional. The information provided in this video is for educational purposes only and should not be considered medical advice. Always consult with your doctor before starting any new supplement regimen. If you enjoyed this video, please hit the like button and subscribe to our channel for more content on health, wellness, and nutrition. We appreciate your support and look forward to bringing you more informative videos in the future. Thanks for watching, and take care.